The fourth domino falls in Erie, Pennsylvania, where at St. Vincent, their ER ran out of nasal swabs for COVID-19 and flu patients seeking treatment, where more patients visited the Erie Hospital's emergency room on Tuesday than any single day since before the COVID-19 pandemic started in March 2020. Wednesday was its second busiest day. And St. Vincent wasn't the only hospital to see an influx of patients. UPMC Hammett also reported a surge in recent days, according to Dr. Mike Knoll, a Hammett emergency physician. Knoll did not have specific data on how many people were treated. And to underpin the point, it's people of all ages, from toddlers to people in their 80s. This is not something that's just impacting the very young or the very old, it's everybody. The maybe silver lining is that the patients they're seeing in the emergency room are moderately ill with coughs, congestion, headaches, and sore throats, but they're just seeing so many of them. It's the quantity, the number of people that they're seeing that is just starting to overwhelm them. Where again, we're seeing these first warning bells where, since the emergency rooms are so crowded, Knoll and Colleran advise patients to call their primary care physician if they are sick unless they feel their illness is serious enough to require hospitalization.